My name is Felix Suter. I am Swiss and I am residing now in Malaysia as a citizen. I was the first one in the family to have hair problems. My father, my brother, my sisters, my boys, my children, none had it. And I believe it's because of some excessive sports activity I did. So I came to Dr. JasG to see what are the options. So when I came, we first tried non-invasive procedures. And also I had a medical condition which didn't allow me directly to do a hair transplant. We had to check with my other doctors first how to do it. And after we solved that issue, I decided to do the hair transplant now in 2025. And we planned when I came here last time in May, then we planned for September to do it, and now it's 7 days since we had it. In May, we increased the non-invasive procedures, and I have to say the hair looked better. I have to say, first of all, the team was very good in walking me through what's coming. Professor Dato Dr was very helpful in explaining. The most painful part was actually the injection of the painkiller and the filler in the back, but which is, I would not call it pain, I would call it discomfort. I slept through the night and I had no pain. And that was for me the amazing part that actually really surprised. But also would like to add is post-procedure care is the most impressive element that I have seen. I've spoken to other colleagues of mine who had it. They were sent home after a few days, at least 1 hour to 2 hours treatment or post-procedure. And that is really makes me more comfortable. The team saw it, the team told me what to do, they took measures against it, so it didn't become an issue. So all of that is really comforting, makes me also relaxed. And being relaxed helps also, of course, the recovery process. So I had experienced various team members. In the beginning, the sales team who walked me through the process, which was good. They opened up to me, they shared with me. I have seen the professor at least 3 times before that for consultation. That was very good. He answered the question to me, he gave me information. But at the same time, he didn't give me too many details that would scare me off. He told me how it works. The information providers always was then given such, but when I needed it. I knew the process, I was not kept in the dark, but I was not overloaded with information. Hair loss is, of course, affecting your self-confidence and you want to fix it. This is not a short-term fix. So what you do, you need to change your behavior in terms of the non-invasive treatment first. You take the medicine, and the medicine I need to take also after the hair is regrown. The brushing the hair, to take care that the hair is nurtured. So that's a lifestyle change. You need to take your time for your hair. It's not just you implanting and you're walking out and everything is fine. It's a process. And so if you really want to do that, then go for a team like Glojas here, who really is taking pride in not only doing the procedure, but also making sure that you're walking out with the least complications. And that's kind of what makes me advisable, looking for someone who is really providing the post-procedure care and not just a quick fix. And after the day 14, I go back to my home and start doing my normal life. I know that the shock loss will come in 2 to 4 weeks, where the implanted hair will go away. Then it takes about 3, 4, 5 months to regrow, and it can be batches. So that's a little bit like a chicken losing his feathers. So that's a process we have to go through, and if you're aware of it and you know it's afterwards better, that's fine. That's why I went yesterday shopping for various hats. So in closing, I would like to thank Professor Dato, Professor JasG, for his skills, for his consultation. I would like to team in the surgery room who did for many hours, early morning, 7:30 until 6 o'clock in the evening, worked non-stop, and also the post-care. This team was really excellent. I would thank them for their kindness, for their understanding, patient focus, and for their professionalism. Thank you very much.